Demand reduction. This feedback, I'll let you know that it helps us to improve on our deliverables and serve you, our society, and indeed humanity. This recorded and is streamed live on our other social media handles. That is apart from the X space here, where we host this program, the conversation. We're also live on our other social media handles, especially at NLA1 on Facebook and at NLA TV on YouTube. You can always go back and listen to the recording right after the conversation and even share with others. I'm glad we have a guest speaker who is far away. thousands of miles away, but then technology has made the entire world a global village. And so we are already connected with her. She's well seated, and in a short while, we will be introducing her formally to make a presentation to have this conversation, and then quite interestingly, as we do have it every week, there will be questions, there will be interrogations on some of this past week, which normally comes in our news highlight segment, and that will be taken by two of our officers, Neta and Peace. Ladies, please let's have the update this week. Thank you very much.
a powerful grassroots movement, one that calls on citizens to take active ownership of their communities. Through WADA, Nigerians are being empowered to rise as frontline warriors in the mission to protect lives, restore hope, and secure the future of our great nation. On Monday, 28 April 2025, the Katsina State Command of NDLEA continued its WADA advocacy campaign with a sensitization lecture at Government Girls Junior Secondary School, Kankia. The session educated students and staff on the dangers of substance abuse, promoting awareness on healthy lifestyle choices and the importance of personal responsibility. The command emphasized the role of youth in championing drug-free communities and encouraged participants to be vigilant and proactive in disseminating the wider message among their peers. Concluding the week's activities, on Wednesday, 30th April 2025, the Kano State Command of the NDA of the agency delivered a WADA enlightenment lecture to students and staff of Al Istigama University, Kano. The lecture focused on deepening understanding of the consequences of drug abuse, both on individuals and the society, while urging students to act as agents of positive change. Participants were encouraged to uphold the values of discipline, self-control, and social responsibility within and beyond the university environment. That's the update for this week. My name is Peace, and I hand you over to Mr. Femi Babafemi.
All right, thank you very much, dear. Peace and Neta. Welcome back from the news highlight segment. Now let's remind ourselves about some of the rules guiding engagement on this platform. And please note that when we approve you to be on the speaker's corner, ensure that you remain muted until after the presentation by our guest speaker and Pakistan, but I've been made aware now that it's actually us from the Czech Republic, and she is no other person than Aisha Siddiqa. Aisha Siddiqa is a scientific researcher at Charles University, Czech Republic, with extensive expertise in drug demand reduction at both national and global levels. As a global master trainer for the Universal Prevention and Global Drug Demand Reduction, she has trained numerous prevention professionals worldwide, contributing to technology. Her doctoral research focuses on leveraging digital learning tools to enhance the competencies of prevention practitioners. Silika holds a postgraduate diploma in addiction sciences, Colombo Plan Fellow from the University of Cyberjaya, Malaysia. She has served in several high-level roles, including Senior Associate Prevention and Healthcare with the Government of Pakistan, Program Manager ST&C Malaysia, Director of Research and Law and Deputy Director of Drug Demand Reduction at the Ministry of Narcotics Control, Pakistan. A long-standing member of ISOP since 2015, she is also a published researcher, policy analyst, and prose writer, contributing significantly to global discourse on drug prevention and public health. Please join me in welcoming Aicha Sidika as I invite her to unmute herself now. While we listen to her, the next 30 minutes there about discuss our topic for today, that is equipping parents and young adolescents with tools for drug use prevention, treatment, and mental health. Please go ahead, dear Lady Aisha. Thank you very much for joining us, and we appreciate your time with us today. Thank you.
Thank you so much, Femi. Am I audible to everyone?
You are very loud and clear across the world. Thank you.
Thank you so much. Hello, good afternoon. Assalamu alaikum, Nigeria, and all our friends from the different part of the world. And I really want to thank you, first of all, to National Drug Law Enforcement Agency. I want to thank you, the Chairman, Buba Naira, retired, the Chairman and Executive Officer, of NDLEA. Thank you, Femi, for taking me in and hosting this beautiful and a very good event, which is going to be very good with our discussion and everything. Um, and then I also want to thank you, Francesco, for the coordination. I want to say thank you to my friend Nadia from the Shelter Youth Community Network who actually connected us. Thank you so much again. As Femi already introduced me, as I worked with the government for the long time as a law enforcement officer, so you can say that I'm feeling like some of you because I was also a law enforcement officer for a long time, and then until 2018, and then I moved to Malaysia in 2019 because I earned a scholarship from Thailand State Department for my postgraduate diploma in addiction sciences. And when I was in Malaysia, then I started working with an organization, Supreme Training and Residency Malaysia. And we also work with the Prison Department of Malaysia as a project manager and project director as well. In 2021, I resumed my services with Government of Pakistan again, and I worked with Ministry of Army for many people and some of our UN partners. But in 2022, I decided to quit my government job, which was actually lasting for 17 years, 1/7, and I decided to be focus more on the research and prevention. And then I moved to Europe, and right now, as Phil already introduced, so I'm also working with ED, European Drug Agency, uh, as an expert. So we are working on the multiple aspect of the prevention, especially related to youth and parenting skills programs as well. So whatever I'm going to share, so it will be my experience from Asia. Of course, my let's start. First of all, we will talk about the parents. I think this is very good to say. Let's start. First of all, we will talk about the parents. I think this is very good to say that the empowering of the parents and young adolescent is very important, especially if we are talking with the perspective of Africa or Asia. And unfortunately, we do not have so many intervention programs, facilities, funding as compared to Europe or America. So, but it is not possible, like it is possible, it is not a difficult task to implement some programs within the society or within the country, which can be in our approach. For example, let's start from the empowering of parents. So, maybe you had a lot of things every day going by, but this is not enough because we need to tell them something more, especially the behavior of the kids, and secondly, how to deal with them. Um, I observed the some of the parenting skills programs which is currently run by the different agencies in the
properly. And thirdly, I will also talk about the parental monitoring, which is very common in Europe as well. Here, if the ministry like education ministry or health ministry or a ministry who is dealing with the narcotics, they are running some programs for the community or society. Most of the time, they are, if they are running some parenting skill programs, they are engaging the parents in some programs. They also have the check and balance and monitoring on the parents. Because if we are the success of any program, either it's a parenting skill program or it's a program for parents, I always say we need to engage community as much as we can because we are law enforcement officer, being a substance use professional, being an addictologist, you cannot work solely or you cannot work in your scenario in order to change anything, especially related to drug demand reduction and drug supply reduction. So it is very important to involve the community. In community, as you know, your main agents are parents, and then your teachers, and then religious. And I was before starting this my conversation, I was listening to Fami, and he was saying that if you cannot speak English, so you have some programs in local language. I think this is a very good, and it's a very focused thing which we need to do. Like in Pakistan, we also have some helplines in our national language, and I hope this will not be a surprise for you. Like in Europe, every country they are having their own language. For example, if I'm working with Czech Republic, they have their own language. If I'm working in Austria, they are having their own language. Germans, they have German. Everything is in German. And seem like in every country, when I'm working in Poland, and they are having their own Polish language. So I think this is one of the best thing that if you are thinking globally, you are adopting something from the global perspective, and you are acting locally. It's much more effective. Effective, I can say, the strategy. So we need to provide maximum access as much as we can to the public, to the community, to the resources. For example, social stigma is very common in all societies. If I talk about Africa and Asia, of course, we are facing this problem. We can say as compared to the other, much more as compared to the USA or Europe or other continents. So, if a person, or for example, if I talk about Pakistan, a woman who is into the substance use and but she don't know how to proceed because of social stigma, number one, and secondly, it is not only stigmatized, but it's a kind of crime or sin to be into the substance by a woman. So, if we have access, like we develop a software, and it was available app for the women who are into the substance, who are using substance, or who are accidentally on the substance use, they can get help online, and if it is not as condition like it's a pre-detox or something, they are like it's initial use, they can get some therapeutic interventions, and this all will be remain secret. So this kind of resources are very important everywhere, and I don't think so. It's only for the country like Pakistan, but for the other countries as well. For if somebody wants to keep their confidentiality and they want to access to the resources, but uh, they don't want to expose themselves. I think this is a very good way to help them. So same like not only parents, but also we need to give them access to the all possible useful resources to community and parents as well. And then I think teaching early interventions and training about the early interventions is also very important. It's not only for the teachers, not only for the community leaders, or not only for the professionals, but for parents as well. So here I just want to mention, I just want to recall something else, and it's here I want to just say something um, about the spectrum of substance use. I know you all are already aware of it, but there are the three domains of this substance use, it's addiction sciences. It's better to say it addiction sciences. One is the prevention, and maybe this will also surprise you because I wanted to start something with the recovery. I wanted to write something about the recovery. Like I wanted to write a paper of the comparison of the Europe and Asia, like how many recovery capitals are used and who is much more using the recovery capitals. And maybe this will surprise you as well. Um, in Czech Republic, the last research on recovery management was published in 2001. And now it's 2025, and they do not have any paper or any research about recovery management by that type of, not only in Czech Republic, but in the other countries as well. And like I don't want to like individually name here, but I checked in 7 countries of Europe, and they do not have any publication. The one country they had a paper in 1994, the 198, and 2001. So it surprised me actually because they have own substitute treatment, they have different kind of treatment, symptomatic treatment, more than us. Like they are practicing the OST since long as compared to Africa and Asia. But unfortunately, there is no program, some concrete programs for recovery management. Mostly they are engaging people in occupational therapy, they are just having the follow-up sessions, and that's all. But the implementation of proper recovery capital it is not yet evident anywhere. So it's in the chunks and pieces. So this is the situation anyhow. So we were talking about the prevention. So let's talk about the youth. Of course, first we talk about the parents, and now we will focus a little bit on the youth and prevention, and then we will talk a little about the treatment and then recovery management. First of all, building the resilience is very important, and we supposed to develop some programs that can foster their self-esteem. Most important thing, their coping skills. and of course decision making abilities. Um, if I present a comparison of the Asian kids, African kids, and European kids, I worked with the three continents, with the children in three continents. Then what is my observation? Like I'm also writing a paper on it. Um, we have like in Africa and Asia, maybe it's because of culture, it's because of the family structure. There are so many contributing reasons, like because of the environmental structure. Um, we have our kids are much more have more, you can say, good skills, good coping skills as compared to the European children. Because I observe here, even they are having mostly in Europe, it's a culture that they are with the single parents. Even some children who are with the families and they are living with parents, they are like a complete good happy family. Still, they are lacking of some coping skills. Like they don't know how to react in a situation. Especially kids, they need to learn how to say no for a substance or some for especially underage smoking. So I will also talk about some of the problems here, which are very common. So secondly, they also need to get, especially for adolescents, it's important to integrate them and for some mental health activities and mental health education to reduce the stigma, and this should be started from the schools. Like we can, because the government cannot do everything, and of course, they are the superstars, but the government is not always the Superman who should be everywhere. So it's a joint duty of the community, society, parents, even the NGOs as well. So there can be some programs like if the government is making some of the funding, some of the programs are missing, they can some NGOs can move a step. They can take a step and then they can contribute for implementing some prevention programs in schools. Um, Even if it is not the awareness, it's I think it's more than enough. That will be a very useful and that will be a very valued contribution for the kids. And then peer support network should be very, very strong, which is I observed in Europe, it's very strong. And then we also have very good peer networks, but they are somehow they are non-directional. So if we will channel them and channel their energies, their potentials towards some integrated programs. If we educate them, we tell them about the issue, how to prevent themselves. I think that would be very, very useful. And the most important thing, which is also my subject, is the digital tools and apps. You cannot stop your kids using technology. Going to the internet and Afghanistan is having when I was working in anti-narcotics force, we had a lot of seizures from Afghanistan, and during the trafficking, of course, there was a leakage. And because of this leakage, we had a big number of the substance users, especially. opiate users. So definitely support that the children, they should have a separate treatment facilities, and women, they should also have a separate facilities for treatment, because the child treatment is challenging. You and sorry, I am on State Department and funding to the global plan for developing the child treatment curriculums, and I'm sure they are, some of you must be go through from those curriculums. Otherwise, you can check it on the ISAP website. So they have a very, you can find some good points for your treatment planning if you are treating the children in your treatment centers. And then if we talk about the recovery management, I think it's also an area which need to be much stronger. And if you want to have some good results, of course, trafficking control is something different. Like you are doing some seizures. I heard that your news bulletin, you guys are doing an excellent job. And I know that strategically and then other with other geographical facts, Nigeria is very, very important. And even we heard about Nigeria while I was taking my winter school with EDU, European Drug Agency, and we were talking about the different neighborhood Africans and Asian countries. So it's a strategically and geographically very important. And you guys are really doing a great job. I know as being an officer, ex-officer, I can say it's a thankless job, but it's a tiring job, and it's really difficult to chase even one consignment at a time. But at the same time, if you want to reduce the substance use in your country, you also need to focus on the recovery management programs. It's not very difficult if you are just focusing on the case management, on the recovery capitals, providing them advocacy, counseling services while on time. It can help individuals a lot to maintain their recovery. So now I want to talk. Femi, still have some time. I'm sure I haven't taken too much time.
Yeah, yes, please go ahead.
Okay, thank you, Femi. So specifically I want to talk. I like more interactive session. I hope it will be interactive after a few minutes. And
Absolutely. If you're able to wrap up in another 10 minutes, then we have
yeah,
almost another hour for interaction.
that's great. That's great. It's always lovely to listen and hear and learn from my other professionals from the other part of the world. I want to talk to you about the legalization of some of the substances. This is a very, you can say, a crucial topic these days. Um, I will start from Pakistan and then I will move towards the Europe. In Pakistan, when I was serving in anti-narcotics force in 2012, there was a proposal from a local agency, a local organization, and UNODC. They wanted to implement, they wanted to pilot oral substitute treatment with buprenorphine. And as I told you, that we have a big number of opiate users because of our neighborhood, and we as expert from the government law enforcement agency, myself and my seniors, we all were against that because we started the proper, implemented the proper symptomatic treatment in Pakistan in 2010. Before that, there was no symptomatic treatment, no evidence-based treatment in Pakistan. So we just tried to implement it. It was we took only just 2 years, and then they came up with the OST or substitute treatment. And we said no. People somehow, politically, and they approached some of our senior political leaders who were actually the ministers and other offices, and they got approved for that. They started a trial in a hospital, and we were, of course, we were closely observing as agency, and then after 15 days, we learned that like, there are some casualty, there is a casualty, and that was because of overdose. And the second day, there was another, and in 2 weeks, we heard about the four casualties, which is Czech Republic, in Lisbon, and some other countries. Sorry, Lisbon is a city. It's in Portugal, and then Poland, and some other countries as well. They are thinking to legalize it, and same gonna be happen with this issue. But with the cannabis now, it's a lot of researches. It's a bombardment of the problems, not in one country, but other countries as well. And I also observe so many fights, especially if I talk about Austria. Vienna is the capital, and I talk about the Prague. It's also a tourist city, and in Berlin, and in Germany. And I'm also evident that the youth is they are buying the things uh, like without thinking anything, without any limitation, and then they are they're drinking, they are having fights because future is actually in our hand, especially if we are talking with the perspective of substance use professionals, law enforcement officers, or policymakers. So, same like if you talk about the oral substitute treatment, I will also bring like on the base of my experience. If you have the proper settings, then you should offer this kind of treatments. Otherwise, it can be a challenge for not only for the law enforcement agencies but for the individuals as well. So, I think we have covered some of the areas. Now, I would like to talk a little about more about the treatment methodologies, and especially if we want to segregate the treatment for the family treatment and for the child treatment and for the general treatment. For the women, I think I remember that we started uh, trained, and I also trained some of the professionals for the women curriculums in Nigeria from the platform of the sheltered youth, and Maria Shiran, in collaboration with Ireland State Department and Columbia Plan, they run a program. They are which is comprising of the four curriculums about the women treatment, how to treat them, or to do the trauma informed care. And I hope so. Some of you are also already trained for the women curriculum. Why I'm mentioning this here because it is very important to segregate the treatment methodologies for women, for children, and also for the men as well. So it doesn't mean that we are going to ignore some of the genders. We're going to ignore the men. Of course, in symptomatic treatment, they should be evidence based, much more focused on and beauty interventions. And the most important thing is the case management. Like if you are working individually, you have your organizations, you have your rehabilitation facilities or treatment facilities. Please try to be expose your facility with the case manager. It's very, very important because a case management can help a lot to the individuals to stay. So if we talk about the recovery, we already talked a lot about the recovery, and you can, but it's also very important to set up some recovery plans. Again, I will say there must be some community groups who can not only support the adults, who can also provide a support for the adolescents as well. They can support the parents if they are to those parents who, if their kids most kids are into the substance use and they need emotional support. They of course need sometimes financial support. They also need some other kind of supports as well. So I think this is all the community work. It should be integrated positively with all the aspects of the society should or environment should be involved in this process. in order to control issue or manage substance use. So this is about the recovery, and then for the parents, of course, government is already doing, but we to be a helping hand for them as well. So I think I quickly cover most of the topics. And Femi, you want to now continue with the questions, or you want me to explain something, some other areas as well?
Thank you very much, Aisha. I believe we can pause you at this point and then take questions, take interventions from others who are joining us from across the world. Once again, we'd like to appreciate Aisha Sidika. Aisha Sidika is a scientific researcher at Charles University, Czech Republic, with extensive expertise in drug demand reduction at both national and global levels. And indeed, she's shown how global she is with her references and deep knowledge about happenings in other countries in Asia as well as